At this time, I would like to introduce Ms. Jody Sugarman Brozan, who is the Executive Director of MASCOSH, the Massachusetts Coalition for Occupational Safety and Health. She will present today on worker safety and the challenges created by the COVID-19 pandemic.
Kevin, thanks so much for having me tonight. As said, I'm the Executive Director at the Massachusetts Coalition for Occupational Safety and Health, and I am very pleased to present tonight. As most of you know, COVID-19 has created nothing short of a worker health and safety disaster. It is really unprecedented. So we have been working very hard over the last 6 months to support workers who are fighting for healthier, safer workplaces, especially essential workers, and we have been doing a lot over the past week support teachers in their effort to ensure that they only go back to school when buildings are safe. So I'm going to present tonight what we've learned over the last 6 months of work and some of the work that's happened in Massachusetts, but also pull from our new report, which is called Dying for Work, which looks at the impact of COVID on workers in Massachusetts. So I'll start with just a little bit of an overview. Massachusetts, like many states, shut down for business on about March 16th or 17th. And at that time, only essential workers were on the job, grocery store workers, first responders. However, as our rates of infection began to slow, the need to reopen the economy took precedent over other health and safety and public health issues, and the state of Massachusetts began a process to reopen. They convened a reopening advisory board that, unfortunately, despite the impact that COVID-19 had on essential workers, included no workers, no labor, and no occupational health and safety experts. We at MASCOSH mobilized what we call our Health Tech Committee, which is a committee of experts in occupational health and safety, to develop a set of recommendations that we sent to the advisory board that called for enforceable health and safety standards, screening, testing, and contact tracing, and real opportunities for workers to voice their concerns, particularly around enforcement of health and safety regulations. Unfortunately, these were ignored on May 18th when the state launched the reopening and issued a set of workplace guidelines. Massachusetts and our partners at the AFL-CIO and other labor partners gave the plan failing grades. And you can see here that the main things that we were looking at, they did not provide health and safety protections, particularly no protections for the aerosol and smaller droplets, which are airborne. They had no way for the enforcement relied solely on workers. And so this is what they did come up with. They created a set of guidelines that were based on social distancing, hygiene protocols, staffing and operations, and cleaning and disinfection. The plan relied on employers to self-certify that they met the standards and didn't require any inspection or any pre-opening effort by government agencies. And to self-certify, they simply needed to print out what was on the website, which was called a COVID-19 control plan, and check the boxes, print out a poster, sign it, and print out some workplace safety posters. So while some employers took this seriously and tried to protect their workers, others just saw this as an opportunity to move forward as business as usual. And one of the most challenging things is that enforcement was left largely to local boards of health without providing them any additional support or capacity. And in some places, the guidelines that were released actually undermined the local board of health authority. So they created these guidelines, they put local boards of health in charge, they told employers that they could self-certify, and the only way that enforcement would happen was if workers complained, and they had no way on their website or anywhere for workers to make a complaint. Responding to that, our Massachusetts Attorney General's Fair Labor Division did open a complaint hotline, even though they didn't have any jurisdiction over health and safety. They collected complaints, they provided them to the local boards of health, and did their best to ensure that those who could do the enforcement got to the right place. And eventually, the Department of Labor Standards, which is the state agency that is supposed to do health and safety enforcement, opened their own complaint form on July 13th. So, are they working? In order to answer that question, MassCosh began looking at data to compile the impact on COVID-19 on workers. This was not an easy task, as it turns out, because the state, despite many, many recommendations early in the pandemic, failed to collect data on the occupation, industry, and employers of those who had tested positive. We were successful in passing a law in June that required that they begin to collect data on race and ethnicity. Part of the data bill was meant to help identify how and why COVID-19 was having a disproportionate impact on people of color, but it also required that they collect occupation data. However, even though that went into effect in July, the data is still missing, and occupation is still missing on about 70% of the data. So this is the report, and we put the report together, and you can find it on our website by cobbling together a number of different sources. First, we conducted a survey with 12 essential worker unions. Those unions reported 1,350 of their members had tested positive for COVID-19. We were through that list, as well as the data provided on the Department of Public Health and state websites through the new law that was passed. We were able to identify 59 workers we know to have died of COVID-19 after potentially being exposed at work. But we know this is just the tip of the iceberg, and that these numbers are likely very gross undercounts. The data from the Mass Department of Public Health does show that 87,000 Massachusetts residents of working age tested positive for COVID-19 from March 10th to July 31st. And 1,349 of those have died from COVID-19. In most cases, there's no record of the individual's occupation, industry, or employer, but you can see from that data that it is likely the data we were able to put together is a gross undercount of the real impact. Still, it is important to take a close look, and we were able to identify from that information the industries which were most affected, March 10th through July 31st. You can see, not surprisingly, that medical professionals are at the top of the list. 46% of the positive cases that we were able to identify with occupation were medical professionals. Next highest on the list were retail food workers, and this includes both restaurant and grocery store workers. And then you can see the rest: administrative and office, sales, construction, education, childcare, first responders, transportation. And again, these are for where we did have data on occupation. And it's important to look at the role that work and occupation is playing, and why work is part of why Black and brown workers in Massachusetts have been hardest hit by COVID-19. And you can see here that Hispanic workers, Latino workers in Massachusetts make up 9.7% of the workforce, but they are disproportionately represented in those essential jobs, including laundry and dry cleaning, food preparation, janitors, and cleaning. 7.1% of all workers in Massachusetts are Black, but 41.2% nursing and home care aides, 37% LPNs, and 33% taxi and ride service drivers. And one of the statistics that is very alarming is 10 of the 31 or 37% of the elder care facility workers who died that we were able to identify as a result of workplace exposure were Black or African American. While the data that we were able to collect from the state paints a pretty dismal picture, we also can use the data of complaints received by workers to the federal agency and the two state agencies is a way of painting a picture of what's really happening in Massachusetts. And in the time that we were able to look at the data, workers had made 4,500 health and safety complaints to the Attorney General's Fair Labor Division, the Department of Labor Standards, and OSHA. When we looked as of August 23rd, OSHA had received 693 COVID-related complaints. from Massachusetts workers and had at least 23 open COVID-related workplace fatality investigations. They have issued just one citation, which is actually not formally issued. It's been issued, but is still, the penalty is still being debated. But when you look at these, while many of those cases were healthcare workers and workers in long-term care facilities, again, there were grocery and retail workers, which is not something that is typically considered a deadly or dangerous job. As of August 28th, when the Fair Labor Division closed its form because the Department of Labor Standards had been taking complaints, they had 2,954 COVID-19 related complaints from workers via the online form. And while it wasn't the top complaint, one of the things about the Attorney General Office complaints, which were all anonymous, which I found particularly disturbing, is that there were 313 complaints where it was mentioned that employers failed to require that symptomatic employees stay home. And so that was very concerning. And as of September 2nd, the Mass Department of Labor Standards, which is the agency which enforces our public sector OSHA law, but under the Massachusetts new COVID-19 worker health workplace safety guidelines, they are the enforcer together with local boards of health. They had 910 COVID-19 related worker health and safety cases open, 42%, which had led to finding violations. So again, while we have specific data on COVID cases, this data on worker health and safety complaints helps really paint the picture of what's going on. And one of the things I like to talk about when we talk about worker health and safety protections is a really important tool that occupational health and safety experts use in terms of developing the proper health and safety protections is this hierarchy of controls. So the first step is identifying the different ways that people can be exposed to the virus, and then using the hierarchy controls to create the protections necessary. And I think when you look here, of course, eliminating that hazard is really critical. Substitution, replacing the hazard, that can mean for teachers, for instance, remote learning. Engineering controls are things like ventilation and air filtration. Administrative controls are things like fabric face masks. We always point out to people fabric face masks are not personal protective equipment. They help protect others from you, and when you and others are both wearing them, can provide some protection, but they do not replace PPE and proper personal protective equipment. So what are we working towards to improve conditions for workers in Massachusetts? First and foremost, we are demanding stronger COVID-19 worker health and safety regulations with well-funded, robust enforcement. And again, one of the main issues with Massachusetts regulations, while we are among just a few states to even have regulations, and I do feel very thankful for that, they don't address one of the key ways workers are being exposed, and that is aerosol transmission of microdroplets. And that is critical. It's much harder, it's much more expensive, so it's easier for the regulations to ignore this. We know the same thing is happening in the state agency that is looking to regulate reopening schools. While teachers are pushing very hard and school staff are pushing very hard on issues around ventilation and indoor air quality, they are very minimal effort is being put into ensuring that schools are going to have better air quality. And anybody who's worked with public schools at least in Massachusetts knows that indoor air quality was an issue pre-COVID. One of the other major issues with our new regulations is that many employers are exempt. One of which, baffling to me, is grocery stores. As you saw, the impact right behind medical professionals are restaurant workers and grocery store workers. So having them exempt and not receive the protections these regulations provide is baffling. The other exemption, which continues to be baffling, is K through 12 schools and facilities operated by the Department of Corrections. Again, these are areas where we know potential exposure, not only potentially going to make people sick, but be a main way in which the virus can be spread across the state. So we have a new hearing on October 14th, and we'll be continuing to demand better, stronger, and robust enforcement of health and safety regulations. Occupational presumption is another thing that we've been working very hard on. For folks who don't know, occupational presumption, it means that any worker, in our case, we're looking at a bill where any essential worker that reported to work outside their home during the state of emergency who contracts the coronavirus will have been presumed to get it at work. That allows them access to workers' compensation benefits. And those workers' compensation benefits are critical for people. That means that they won't have to use all of their paid time off to recover from the virus, but also for those who don't have paid time off or ample paid time off, or as we've seen, the virus can have much longer term effects requiring a longer time for people to recover. Workers' compensation benefits would pay for that. Obviously, if workers don't have health insurance, the workers' compensation benefits will help pay for that. And more for me, and very importantly, is those who've lost loved ones as a result of COVID-19 contracted at work will be able to receive the death benefits that they deserve. So we've been working very hard on securing occupational presumption for those workers who worked outside the home during the state of emergency. And then finally, expand paid sick time. This is really a critical link here. One of MassCOSH's key programs is something called an Immigrant Worker Center. We provide direct services, support, and organizing support to immigrant workers. And we are hearing story after story of workers who don't have enough paid time off, in which the Families First Coronavirus Response Act, FFCRA's paid sick time provisions, they don't have access to that, or it's not enough. And as I said before, those 313 complaints to the Attorney General's office where it mentioned employers failing to require that symptomatic employees stay home. One reason that workers continue to come to work while symptomatic, in addition to often being forced by their employer, is that they don't have enough paid sick time. And they're making the decision between paying their rent or potentially exposing their colleagues. And we also have seen many, many situations in which workers have been fired for testing positive for COVID-19, fired for using the FFCRA benefits, and other forms of retaliation. So it's really critical that we expand paid sick time and we continue to find ways to protect workers from retaliation. And just a little overview of the different kinds of resources that we've provided to workers over the last 6 months. We have created multilingual toolkit, free training and technical assistance in English, Spanish, and one of our town halls and webinars, one of which we did in English, Spanish, and Portuguese, access to our network of occupational health and safety experts, and a hotline that provides where we can work directly with workers who are experiencing COVID-related injustices. And I just want to point out as well, or mention, that we have been working really closely with our partner unions, and that includes MNA, MTA, and AFT, which are the teachers unions here in Massachusetts, to support their efforts to ensure that reopening schools only happens when it's safe. And in fact, on Monday night, we were working with the Boston Teachers Union, which negotiated an ability to do walkthroughs in every single building to confirm that the health and safety upgrades have been made before teachers enter that building, and created a checklist. We trained 250 union members on how to identify and look for health and safety problems within the school related to COVID. So we continue to be super busy and work very closely with our allies in the labor movement. Here's how you can reach MassCOSH, our website, where you can download and find a copy of our Dying for Work report. My email is here, and I'm happy to answer any questions.